Without further ado, let's begin our class for today, and that will be on the skeletal system. So I hope that you're all ready and that you are prepared. Your skeletons are prepared. Okay. So let's start with the skeletal system. As well as giving your body support and shape, your bones provide protection and, through their interaction with muscles, allow your body to move and adopt different poses. So without your skeletal system in conjunction with your muscles, no, in conjunction with your muscular system, you won't be able to move and you won't be able to do the things that you do. Even lying down, as simple as lying down, as simple as standing up, is being done by your musculoskeletal system. But today, as I've said kanina, we will only tackle the skeletal system because if we're going to include the muscular system, this is going to be very long. All right. So, how does the skeletal system protect our internal organs? I think it's very obvious, no, from the stance of our bodies, how our skeleton is able to protect us. So, just like misaligned teeth needing braces for support, most animals have a firm framework, and that is your skeleton, that gives physical support and protection for the body and often provides services for the attachment of muscles. So, naibang animals that have hydrostatic skeletons. So, liquid man kaayo ilahang bodies. So, they don't really have like a solid skeleton. They don't have a calcium rich skeleton. So, these animals, just like your earthworms, have what you call as your hydrostatic skeleton. Animals like your crabs, your shrimps, your lobsters, they don't have the same skeleton as us, which is internal, no? Their skeleton is found outside, and that is why they have sort of like a hard protective shell, and that is what you call your exoskeleton. Just like when you try to eat your shrimp, di ba? Kailangan pa din mo siya i-peel, and that thing that you peeled, which is considerably tough, no, that thing that you peeled is actually their exoskeleton. And then some animals undergo molting, wherein they will shed that old exoskeleton for a new one. These are some animals that undergo molting, just like your bees, your grasshoppers, your cicadas, and the like. I don't think we have cicadas here. Do we have cicadas in the Philippines? I'm not very sure about that. But yeah, your cicadas. I think we do. Do we? I think we do. Mm. And then we have like the complex animals, just like your dogs, your cats, your fishes. Kita, we have our endoskeleton. Endoskeleton meaning internal skeleton. So let's learn some anatomical directions. Uh, First, let's learn about anatomical directions so that we can properly aside from position, but we can properly locate parts of our bodies because we're talking about bones. And in the future, when if some of you are going to go to like paramedical courses, it's very good to learn about anatomical directions because it tells you where that specific part is. Okay, um, let me change my ink first. So our normal anatomical position is standing up, facing front, and then your palms would be facing the front as well. So it's like this. Now, so it would look like this. In ani ang anatomical direction. Okay? So it's you standing up, facing front, with your palms facing the front, with your thumbs outward. Okay. So you have these distinguishing diana directions. First would be your anterior and posterior, or your ventral and dorsal. When you say anterior or ventral, that means that's front, the frontal part, or towards the front. And when you say posterior or dorsal, that is towards the back, or it's the rear, sa likod. So when you say like When you say anterior to me, that means it's front. It's right in front of me. Posterior to me, likod sa ako ah. Mm, yan na siya. So, next would be your cephalad and caudad. Okay. Cephalad, it pertains to your head. Dire siya. Towards the head. That's cephalad. When you say caudad, it's towards your feet. So, naatay term ana no, we have cephalocaudal, meaning from head to toe. Like kanabitang tanawon bitaw ka sa imuhang kuan, sa imong maldita na classmate like sipat-sipatan ka. Kadumdum mo katong kuan, katong namim bitaw nga katong mga bata na nag-away. Eh, ba't ka namamangga? Kato bitaw siya. Oh, tanaw siya head to toe. So, why are you looking at me cephalocaudally? Na dayon. Para social mo paminawon. Rods, I'm just kidding. But that is cephalocaudal. That's head to toe. Okay. Now, next we have your superior and inferior. When you say superior, it is above. Inferior is below. Like, for example, my shoulder is superior to my elbow. Yeah, makes sense, right? Because my shoulder is above my elbow. Hmm. Mas taas pa na nga kung, ano sabi siya sa shoulder? Help. uh, Say Bisaya sa shoulder, tabangi ko. Say Bisaya sa shoulder. Abaga, ha? Abaga is chest, right? Abaga is chest. Di ba? Am I wrong? Wait lang. Ay, dugha. Oh my goodness. Abaga di. Hala ka. Uy, sorry. Okay. Di mo mas taas man dyan yung abaga kaysa sa imong siko. So it makes sense, right? Baga ang chest. Isn't baga like Tagalog? I don't know. Please don't ask me about technicalities in our language. I don't know. Kada bitong ko an bitaw. Kada bitong I think it's a plight. It's a problem for all of us Filipinos, especially Filipinos not from the NCR part, the north part. No, the NCR part. Most of the people in the NCR that I know only know Tagalog and English. That's it. But for us, nga taga South, we know Bisaya, Tagalog, and English. And Bisaya or Cebuano. Cebuano is it's the language. Cebuano is like a whole new language, right? It's a different language than Filipino. So it's very difficult, no? Maglisod ta sometimes. Sorry pag-translate ganyo eh. Like being multilingual is not easy. Dapit dughan man ata chest. Dapit? Huh? Anyways, so that's superior and inferior. And next we have your medial and lateral. Medial, it pertains to the middle, and then lateral would be away from the midline or pagawas. Like for example, um, uh, your sternum, this bone right here, kani siyang naa sa tunga-tunga do ninyo. Kada ito kung i-rub ninyo kay murag kung i-rub ninyo siya kay murag malisan mo ginhawa ka na siya. That bone is medial to your shoulder, ana, or your pertaining to your anatomical position, your ano lugar, your what do you call this? Your thumb is lateral to your pinky, nana. Kay inana man ang normal anatomical position, right? So this is lateral, and this is more medial, ay mong pinky. So that's medial and lateral. Next will be your proximal and distal. So when you say proximal, it is nearer to the center of your body, and distal means away from the center of the body. So same yapon siya, marag same yapon siya, no. Your pinky is more proximal to your body than your thumb, or your thumb is more distal than the pinky. Ana. And then you have your radial and radial ulnar and dorsal plantar uh, plantar surface. When you say radial, of course, it pertains to your radius. So, kani siya, how do you know na dara dapit imong radius? Basta inline siya sa imong thumb. That's mojo na siyang timailhan, no? Wherever your thumb is, naa dira imong radius. That's the bone, no? Kana siya. So, this is the radium. Radium? Na yung mga element? Radius. Sorry. It's the radius. And this is the ulna. Kini siya. This will be the ulna. Pangit ka kung kuan. Ha! Ang green screen. Ayan. This will be the ulna, and wherever your thumb is, naada na imong radius. Okay? I'm so sorry for saying radium ganina. Nahimo siyang element. Nahimo siyang chemistry. All right. And when you say dorsal and plantar, it's more associated with your feet. No? Okay. So, kana di imuhang lapalapa that is congruent to your palms, no? Pero kay naka-plant man siya on the on the ground, you can't really position it like your palms, no? So mo nang plantar surface ni siya. And then this will be the dorsal part of your foot. I cannot show my foot. I'm sorry. I can't. Kaya madaot ang green screen. All right, so these are your anatomical directions. So of course your skeletal system have parts, no? You have your bones, which are, it's part of your skeletal system. And then you have your joints, your cartilages, and your ligaments. I hope you still remember these lessons from your junior high years. Oh, so your bones, kabalo naman mo ani, no? Bones such as your there are a lot of bones. You have your for here are some examples. You have your sternum, katotong gipang mention ganina, your ulna, your radius, and etc. Kana sila ng mga bones. These are very obvious bones. And then you have your joints. Okay, joints. This is between a bone, between, ano na lang, a bone and another bone. That's a joint. Joints. Then you have your cartilages and your ligaments. Oh, kinis la kay mga connective ni sa mga connective tissue, no? So, naay mag-connect from muscle to the bone. Mm. Tantin as la because it allows movement. Oh. And then you have like bone to bone and muscle to muscle na mga connections. So those are your cartilages and your ligaments. So of course you have two divisions of the skeletal system. Nakay ka nang in the middle, Jude. That's what you call your axial skeleton. So right in the middle. Right in the middle. In the vertical middle ni siya. Meaning kini siya. So your skull, your spinal column or your vertebrae, and your rib sakto ba ko? Oh, your rib cage. Kada sila. That's part of the axial skeleton, right in the middle. And then your appendicular would pertain to your limbs, no? Your arms, your legs, kana sila, because it's not in the middle, right? So those are your divisions. Now, what are the functions of the bones? First, it supports your body. It's very obvious, no? Because without bones, you'll never be able to stand up, you'll never be able to walk, etc., etc. Next, it protects your soft organs, just like your brain. Importante kim mong brain. Your brain is very essential for a lot of things, not only for thinking, but all of the major and minor functions of your body is being governed by your brain. So, if maaksidente ka, o wala kay skull, dito ka matay. Inana. So for your brain to be safeguarded, to be protected, enclosed na siya sa imuhang hard skull. Mm. And then your brain is also floating in cerebrospinal fluid, so it helps, right? Kada itong, have you ever tried have you ever tried sa kapangita ko kanang uh roller coaster nana I'm like looking for the word katong mga naka-try nag roller coasters dito sa kanang peryahan bitaw sa pista inana or anywhere else kana siya if you've tried that. Di ba sometimes kana bitong kung paspas kay ang roller coaster kay um feeling mo kay mura kay nabuyong like mura kay na inana. It's because of your brain being kanang naamo ko'y velocity, 'di ba? Of course, ay velocity with roller coasters and of course accelerate ang ma-accelerate ang imong body and then mura bitong mabilin imong brain inana mura siya mo ana siya. So it is surrounded by cerebrospinal fluid but mura mo igo ang imong brain against your skull. Mo na sometimes mura kag mabuyong nana. That is also the case for like for example for Iron Man. Like Iron Man? What are you talking about? Kailangan mo ni Iron Man, 'di ba? So if you know Iron Man, 'di ba, he is enclosed in a metal suit, no? So kind of itong the lengths that he goes to, the heights he goes to, the say, 'di ba, paspas kay mo fly si Iron Man using his repulsors. In real life that is impossible because if you subject yourself to that acceleration, grabe kikapaspas ang acceleration, no? And you are enclosed in a metal suit, dili na makaya si mong brain. Ang sige na siya kaigo sa skull. And pwede na siya mo faint, mahimatay ka jud, na or mahimatay ng bongga. Either of those. But Tony Stark would experience a considerable amount of brain damage at the end of like months, even months. Kay paspas kay iyang dagan, right? Well, what am I talking? Why are we talking about Iron Man? Kaya lang, kanang importante lang dyan ni siya ang imong skull sa protection sa imong brain and your rib cage as well. It protects a lot, but your essential organs, your heart and your lungs. Another is movement due to attached skeletal muscles. So you know this already. And the storage of minerals and fats, which are found in your marrows, no? Manang ka na mo, ingon ta ka na mo, kauntag bulalo. Ang tarap-tarap ng malo. Marrow. And then, blood cell formation or your hematopoiesis. So, very important ni sila. Mao ni siya ang functions of the bones. So, bones are very important. Not only are they for moving, but they are important for blood cell formation as well, protection, and storage of minerals and fats. So let's go to the bones of the human body. There are apparently 206 bones in the human body, and I don't think it's gonna change in the next couple of years, of course. Basig kung mag-evolve ta, okay, fine. O yan. But it's gonna take like centuries for that to happen. So there are two basic types of bone tissue. You have your compact bone and your spongy bone. So ang compact bone mo is homogeneous. It's very solid. Mo na siya ang very solid part sa imong bone, no? Ngano day, ma'am, naa day part sa bone nga dili solid? Yes. Di ba like dili solid, but what I mean is dili siya kanang how do I say it, like kanang very dense kana siya because there is actually a part of your bone that is not very dense, no? And that is the spongy bone, which have small needle-like pieces of bone, and they have many open spaces. Ngano naman siya open space? Number one, it dara ang daloy sa imuhang kung ano imong arteries and veins. So ginagmay lang na arteries and veins. Kuan ka ng nutrition, food supply, and oxygenation of your bones. And then, importante sa na siya so that our bones would not be very heavy. Bones, maglisod tag lihok, no? Mao na siya. So naay parts atong bones sa spongy. And just like your mura bitaw kanang pareho bitaw sa birds, no? Some of your not some but your birds for them to be able to fly, dapat ilang bones dili bugat. It makes sense, right? So muna ilang bones, they are hollow. Kita na sa tay spaces, no? Na tay spongy bone. So that dili kay siya bugat. So here are the classifications of bones on the basic shapes. You have your long bones, just like your humerus, your femur, radius, ulna. These are long bones. And then you have your short bones, really, really gagmay, like the ones that you can find in your wrist, your carpals, and the ones that you can find in the ankles of your feet. The tarsals, ganun siya. Carpals, then tarsals din sa tail. So these are your short bones. And then you have your flat bones, which are majorly found in your skull. Kaya imong skull, dili naman na siya one whole bone. It has many bones fused together. Na siya. So, kana siya, imong flat bones, they're found majorly in your skull, and kinis na siya as well. Flat na siya. And then you have your irregular bone, just like your vertebrae. Seen kanang bukog bitaw sa lechon ninyo o kana siya, 'di ba irregular man na siya, wala siya kanang one whole common shape. That is your irregular bone. So your long chain mostly. Oh, what happened? Oh, ano yun? I'm sorry. Na notification. Anyways, they have a shaft with heads. They contain mostly compact bone, and they are used for support and also for red blood cells and white blood cell synthesis or the production of these cells. No, um, very good example, Ani, would be your femur, kaning imuhang leg, uh, the kuan, the thighs. So if is this Kim Kardashian? I don't know. Dako kay siyang sabot. This one right here would adiri imuhang femur. So that one. That is actually like the longest bone that we have in our body and the strongest bone in our body. So kanisha, it produces a lot of your um red blood cells and white blood cells. So very important kayo ni sila, no? Kini mga long bones. Actually, all bones are important, but the long bones, so they produce a lot of your blood cells. And then you have your short bones, which are generally cube shaped and contain mostly spongy bone. They have to be weightless, not weightless, but they have to be really light, um, because well, they're very small bones. And then you have your flat bones, which are thin and flattened. They are usually curved, and they have thin layers of compact bone around a layer of spongy bone. So they're relatively light. These are found in your skulls, your ribs, kana sila, and your sternum. This one right here, right in the middle of your chest. And then you have your irregular bones. So they're named as such because they have an irregular shape and they don't fit into other bone classification categories. Just like your vertebrae and your hip bone. Kana siya, your ilium. Call that your ilium. So kana siya, they don't really have like a regular shape. Your vertebrae, depende sa segment sa imong vertebrae, no, kanang nakay cervical segment, meaning cervical is the one here, sa imuhang neck, and then your thoracic segment, kaning diri thoracic meaning your thorax. Ma'am, the thorax? No, the thorax. Okay. Kanimong chest dapit, and then you have your lumbar vertebrae, which are found like in the lower back. Kana sila lahi-lahi na sila shapes. If you look at your lechon, lahi-lahi sad na siya, no? If you're going to look at the vertebrae of your pig, lahi-lahi sad siya. That is also the case for humans. It's also not the same. And then let's go to the gross anatomy of a long bone. So your long bone would have the diaphysis and the epiphysis. So when you say the diaphysis, Let me change my ink for a while. This will be your diaphysis. That's the one right in the middle. And when you say epiphysis, that is the upper part and the lower part of your long bone, no? Dara mo attach or dara makita imuhang joint. Your diaphysis would have a shaft, and your diaphysis is also known as the shaft of the long bone, and it is composed of very compact bone, compact kaayo, tightly woven calcium deposits. Actually, na. Whereas when you talk about your epiphysis, it is or they are found at the ends of your bones, and they are dagan siyang holes, no? Dagan siyang buslot, and they are composed mostly of spongy bone. As I've said kanina, spongy bones, they have quite a lot of holes. And siya. So, question: in what part of the human body can you find the smallest bone slash bones, and what is the name? Please answer in the chat box. Sabi ni Roldan, they are found in the ear and they're called the stapes. All right. In what part of the ear? The outer, the middle, or the inner ear? Mabel says ear. Hmm? Can we be a little bit specific? Is it the outer, the middle, or the inner ear? Correct na ng ear. The middle ear? Mm-hmm. How about the others? How about the others? Hello? Sabi ng mama mo, mama na lang daw ang tawag ko sa kanya. Wala. Hello, where are the others? Busy mo upang laba? Ayan, middle ear. All right. They're found in the middle ear. Kanina silang stapes, no? Correct na siya. So, it would be the stapes. And they are found in the middle ear. They're responsible for transmitting the vibrations. So, if madamage gali na inyong stapes, goodbye to us. If it's going to be damaged, there will be like, because it's very, this cannot be repaired properly. So if it gets damaged and you can't really hear well, yeah, so that's the sad part about it. It's really small. Have I seen stapes? No, I haven't. I haven't seen stapes. I have only seen it in Google. Again, because in cadavers, kanabitong gina-study na mga skeleton remains of people, they don't really keep the stapes, or they don't really get quote unquote harvested from the body because they're so small. Mm-mm. Ayan. Thank you very much to those who answered. And congratulations to those who answered correctly. Very good. Okay. Okay. So alongside your diaphysis and your epiphysis, you have your periosteum. The periosteum is like the skin of the bone. If you notice, notice niyo na ano sa kanang mag-ihaw bitaw mo or kanang gamitan lang gud na inyong lechon good nana siya ka na marag covering sa ilang bones or ka na magbulalo bitaw mo or mag ano mo nilat ang baka na you will see that naana sila lining sa ilang bones. It's like the skin, and that is your periosteum. It is the outside covering of the diaphysis, and it is a fibrous connective tissue. It is a fibrous connective tissue membrane. So it helps in the protection of your bones, no? And then you have your Sharpie's fibers, which secure periosteum to underlying bone. So kanisha, these fibers right here. And then, of course, your bones would have arteries because blood needs to be supplied to these bones for nutrition. No? Importante sa kung wala yung nutrition ng bones, wala, patay mong bone. patay mong bone. Dili malagas ihang calcium. So importante nga na ay arteries, of course, na mag-supply og nutrient rich blood paingon sa imuhang bones. Then your long bones would have articular cartilage, which covers the external surface of the epiphysis, and it is made of hyaline cartilage, and it decreases friction at joint surfaces. Now remember what I said, that these long bones, kaning sa ilang mga epiphyses, kay plural man na siya, no? Epiphyses, kaning siya, they are attachment to, they're sort of like the site of attachment to another bone. They are the site of joints. So, dili man pwede na ang usa ka bone, when they get attached to another bone, ana lang, as simple as that. Like, attached na sila, manana na siya, ma'am. Of course, your bones will not be attached without support, without some kind of cushion. Kay kung wala ni siya support, imagine na mag-grind ang imuhang bone against one another, imong bone, it's gonna hurt a lot. Sakit kay na siya, no? So, dapat na ana siya cushion na, and that is your cartilage. You know, so your, in this case, that will be your hyaline cartilage, and in the middle of that, surrounding that area, would be your synovial fluid. Mo ni siya ang fluid nga kanabitong kung magka-arthritis ang usa ka person, mao ni siya ang mudaghan nga fluid, and usually when this gets extracted, or if grabe na kaayo ang kuano ang fluid na and sakit na kay ang joint, if it gets extracted, it's usually like pussy. It means nga nag-inflame na to siya nga joint, no, it has been through like arthritis, and then there is like overproduction of synovial fluid, and at the same time the presence of pus. Ano siya. So importante kina synovial fluid, and as you age kanang gakahinay na siya o kakawala. So mao nang mas prone jud ang mga people of old age to arthritis. Lee has a question. Unsay relation ana sa paglaguto, ma'am? Okay. Ang laguto is just kanang air bubbles na siya that is being produced by the usage of our muscles. Um, kita man good when we, like for example, when we work out or when we do like a lot of activities, some of uh our muscle cells, they undergo fermentation. Mm, Kana siya. Fermentation. So, di ba, if you've heard of fermentation, ma'am, di ba fermentation is used to make like alcohol? Yes, for some things. But for humans, when we ferment, using our muscle cells, and actually all of our cells do that. But majorly because we're talking about movement, no, our muscle cells. When our muscle cells ferment, kanabitong nahutdan bitaw siya og sugar, dili siya maka apas sa imuhang usage of that muscle, so dili makaapas ang supply of sugar, so it undergoes fermentation. When it does that, it produces lactic acid, and some of this lactic acid, it produces kanang tiny bubbles, ana siya, and these bubbles, they go to our joints. So mo na maglagoto dayon, no, tsada ra ba kay siya paminawon, these are just bubbles, they're not like, we're not breaking bones here. We're not. These are just bubbles. Now, di ba naamanay ka ng topic like sa una nga, is it like harmful to crack your knuckles? Like, kanang mag-ana-ana mo sa imong, dili, bad example kay akong hands because dili mo galagoto akong hands, no? But is it bad? It's not. It's not bad. It's okay. It's all right. But that should be a sign. Kung grabe kayo, dagan kay lagot o nagakahitabo, that should be a sign that maybe you are overusing your muscles, or that when you exercise or when you do activities, you don't breathe properly, because breathing is important in cellular respiration, magod. So breathing and sugars, both of those things, but in this case maybe the breathing exercise. So just make sure, if you feel nga grabe kay mo lagot to akong mga joints, you have to check if when you exercise, you breathe properly. Enough. Ruts. Okay. I hope I answered your question, Liha. So, mona siyang laguto. All right. So, that will be, we have the medullary cavity. Um, Cavity meaning opening. Mo na siya ang pasabot sa cavity, no? It is basically the cavity of the shaft, and inside of this cavity contains your marrow. So it could either be, not either, but both. Both. You have your yellow and your red marrow. Your yellow marrow is important in the storage of fat. Mo ni siya ang lami kayo nga part sa bulalo. Ano bulalo? Tarap tarap. And people are saying like it's collagen. It's okay. No, it's not collagen. It's fat. Collagen is not found there. So yeah, you're just eating like straight up fat because um it's a it's a storage front of your muscles. It's a storage front for your fats in your bone, no? And naasad kay red marrow, which is actually important in red blood cell formation. Actually, not just red blood cell, but all blood cells. So you have your bone markings. So your bones have the surface features of your bones have bone markings. So these are the sites of attachments for muscles, tendons, and ligaments, and also the passages for nerves and blood vessels. So you have your projections and processes which grow out from the bone surface. I'll show you pictures later. And then you have your depressions or cavities, meaning kanang hollowness, no? And these are found to be they look like indentations. So kana siya agianan siya sa mga bagay-bagay. Oo. So like imuhang this I think this is the best example that I could give you kaning inyong sa likod. These are naakay duha ka bones that no on your right and left diri sa likod. You have your scapulae. These are kana imong wings. Wing bones kana siya. You have your acromion processes there. If you feel like if you feel that ma-feel na nimo kanang murag na ay kanang protrusion, murag kanang it lagi siya dapit ma'am. Yes, that is a process. Hmm? Chromium process that is found in your scapula. Just try to feel your bones, ana. So kanang mga prominent kaayo like kahait ba kay ani oy, these are usually your projections and your processes. I'll not talk about this anymore. Yeah, not very. They are important, but you can just read through that. And then we have the types of bone cells that are found in your bones. Of course, you have your osteocytes, osteoblasts, and osteoclasts. When you say osteocytes, these are basically the mature bone cells. These are your bone cells. That's your osteocytes. And then your osteoblasts are your bone forming cells, meaning before they become osteocytes, osteoblasts na sila, no? Wala pa na sila nang mature. So, pwede man ka na daghan kayo osteoblast ang gibuhat sa imong lawas, pero not all of them will get to mature, no? Na may uban ana lang nga, ay, wala imong body ay faulty man ni ay kanang medyo wala kanang medyo kulang iyahang kuan, medyo kulang ang iyahang organelles, medyo na something wrong ani nga cell, medyo na something wrong ani osteoblast, so they never really get to mature, no? So mature na cell na niya, that is then your osteocyte. And then your osteoclasts. These are bone destroying cells and they break down bone matrix for remodeling and release of calcium. Now, why do we need to destroy bone? Why do we do that? Okay. It could be your it could be that you are a child. Pwede. Na, di ba, ang bata kay growing ba na siya napaka-person, no? So, how do the child's bones also grow? So, naay part na niya nga, gubon ni osteoclast, gubon niya, dayon i-remodel niya, it will make it longer, and then naay kanang at the ends, the epiphyses of your bones, pwede niya i-remodel, i-reshape niya. Nana. So, maunang task ni osteoclast. And sometimes, when there is a very low amount of calcium in your blood, ang buhaton na ni osteoclast kay with the help of your hormone no, that is found in your parathyroid gland, iyahang i-gubon ang iyahang bone, ang imong bone, and then ang katuday yung calcium will go into your bloodstream. Na siya. So, huh? Mom, naray calcium sa blood. Yes, naay calcium sa blood. Ayan. There's calcium in the blood and it is important for your heart. My mouth is so dry. Okay. So, yeah. So, mo ang task ni osteoclasts, and osteocytes. So, your bones also have your lacunae and lamellae. Your lacunae are cavities containing sorry, not blood cells, sorry, bone cells, and they are arranged in concentric rings, just like your trees, no? Kanang kahoy nimo, di ba? If you're going to cut off the trunk of your kahoy, makita nimo ang rings, no? And the rings signify the growth of your tree. Same with your bones. So, nagyan pa na siya yung rings sa imong bones, but they're very small. And then you have your lamellae, which are rings around the central canal, and these are the sites of your lacunae. And then you have your canaliculi, which are tiny canals, very, very small, okay, microscopic gani, and they radiate from the central canal to the lacunae, and they form a transport system. The transport of what? Transport of a lot of things. Transport of your nutrients, transport of your cells, pwede na siya. And then let's go to the process of ossification. Ossification basically is the formation of bone. That's what it is. So you have two kinds of ossification. Let me drink a little bit of water. My throat is like desert. Eh. You have two kinds of ossification. You have your intramembranous ossification and your endochondral ossification. When you say intramembranous, in meaning within, intra, and your membranous meaning membrane. So within your membrane, ossification within the membrane. So in this kind of ossification, osteoblasts produce bone within connective tissue membranes. So inside of your connective tissue, and they make flat bones. Flat bones such as the bones that are found in your skull. Yan siya. Your ribs, your sternum. Mm. They're made through intramembranous ossification. And then you have your endochondral ossification. Endo meaning sa sulod. Mm. And then chondral pertains to your cartilage. Cartilage. The word chondral. Okay, so it means that this is an ossification within a cartilage, and this is where cartilage is being replaced by bone. Ayan. Because of course, when you when you were a child, when you were still a fetus inside the womb of your mama, dili man na siya diretso nga bone, diretso like pak na din bone diretso. No, of course not. You started off as a fetus. You're very small, very soft, very fragile, no? So definitely wala pa bones anak nga time when you were still a fetus. So during that time, you were all made with cartilage. Ano cartilage mo? For example, kini mong nose, no? The way that you can bend your nose, that you can, tap on it without breaking it, or even the pinna of your ear. Nanong ma-bend ba mo na siya without breaking it? Because it's not made of bone. It's made of cartilage. So all of us were once made of cartilage. No? The whole body. And then eventually, pagka mature inside the womb of our mothers, nana din bones. Ano. So, ang imong endochondral ossification, naa na siya duha ka buka classifications no, naa kay primary ossification center, which is focused on the diaphysis of the bone, Diaphysis meaning like the body of the bone, no? And then you have their secondary ossification center, which is more focused on the epiphyses of your bones, meaning the end to the end, the one end to the other end of the bone. So of course, in embryos, katong you mentioned kanina, the skeleton is primarily hyaline cartilage or made of hyaline cartilage. So during development, this cartilage is then replaced by bones. No, eventually, hinahinay pa na siya. And the cartilage remains in isolated areas. Dayon, they don't really develop as bones, just like as a katong gayon kaganina. It's found in the bridge of your nose and the parts of your ribs. I actually kanang connection na nasa ribs, no. I'll show you a picture later. And then your joints, of course. Lisod gid kung puro ra na siya. Lisod gid kung puro ra ni siya bone, no. Di nato mamlihok atong mga limbs. No, so pili ra siya ana-ana ra na siya. Murag si Batman bitaw. Have you noticed Batman in Dark Knight, the Dark Knight Rises kana siya na movie? Inani siya mulihok ko. Wala wala siyang walay joint sa neck. Oo. So, inana unta ta kung wala tay joints. So, in bone growth, the epiphyseal plates allow for growth of long bone during childhood. So, again, the epiphyseal part would be the one in the middle, right? Kana siya. And new cartilage is continuously formed like really really fast during this time. It only takes like a matter of weeks, and the older cartilage becomes ossified. So cartilage then is broken down and then being replaced by your bone, and then bones are remodeled and lengthened until growth stops. So bones change shapes somewhat lang, with the help of your osteoclasts and your osteocytes, and the bones grow in width dayon. So this would be like the sort of like the progression of ossification or long bone formation and growth. So you can just read through this, okay? You don't have to like one by one this. So how do you calculate your final height? Ayan. So just a bit of a trivia. How do you know how tall you really are? Like, mo na jud na imong finish line. Like, di na jud mabang-bang. Okay? So, for the boys, you get your father's height and your mother's height. Like, for example, your father's height is actually same enough for the boys and the girls, pero dili lang siya mag-differ. For the boys, you're going to add 5 inches, and for the girls, you're going to subtract 5 inches, and then you divide it by two. Okay, I found this to be true. You know why? Because my father is around 5'4". My father is your typical Filipino man. He's only 5'4". My mother is around like 5'2", right? And then we're going to remove like 5 inches to that. So that's 5 feet 4 inches plus 5'2", 5 feet and 2 inches. So that's uh 10 inches and 10 feet. Sorry, 10 feet and 6 inches. And then if I'm going to remove 5 inches, that will be 10, 10. Sa ito kani 10 6. So mayroon siyang 10 1. Ana. Then divided by 2. So divided by 2, this will be like 5 feet and 1/2 inch. I'm only 5'1". That is so correct. How about you? Try din you calculate, be? And then final height. Ma'am, kanang wala ko kabalo. Pila ang height sa akong parents. Sige, bana-bana lang mo dan ha. My brother's music is so loud. I don't know if you can hear it. I'm gonna charge my tablet. Ay, lobat siya. So, walay naghatag og answer sa ako. Wala dyan calculate na. Sige na lang, oy. Okay. who are interested, you can ask your parents later kung pila ilang height, and then you can calculate it, and you will realize nga, oy, oy, mora jud ni ang final, mo na jud ni siya. Okay. So that is how you calculate your final height. But this is just an estimation. Dili mo jud ni siya ang final like this doesn't really like 100% predict your future. So just read through that, huh? All right. So, uh how are bones important? Bones are very important because they allow you movement, right? Now, what if something happens? Something bad happens. Like for example, a fracture happens. Okay. So I'll tell you a story. Way back in 2018, a long time ago, but I know it's a long time ago, like 3 years ago, but I can still remember it really fresh in my brain. So, we usually have classes, not usually, but if we were to see each other face to face, if nag face to face classes pa ta, we would have seen each other at 6:30 a.m. ang klase, no? So imagine this. I was going to the office at 6:20 in the morning, and then I caught my on a kanang nagkang bitaw nga rail sa kuan sa kanal. Nama ko'y kanal ra nga gamay no going to our office, and then nagkang siya gamay, so nasangit ako ang tiil, and then I sort of sprained. I heard the sprain happening. Like nadunggan din ako internally, and then I hit my leg, my knee. Sorry, I hit my knee on a very rocky surface. Like grabe ka rocky, kind of landscaped rocky. And then na-shock ko because it was really really painful. I mean, I've had sprains before, no? I've had sprains a lot. Not really a lot, but I've had sprains before. So, kanisha nakuratan ko, oh my god, it's so painful. What's happening? I couldn't stand up. So I didn't really suspect anything. And then I asked my friend, it was so embarrassing, by the way, because I was on the ground and there were a lot of students like passing me by. Mom, are you okay? Mom, are you okay? And it's like, leave me alone. Biyay ko ninyo diri. Because I was partially like so ashamed. Gabi ako kaulaw. And then, if I knew that if I tried to stand up, I would faint. So, wala ko ni tindog. Narinig ko sa ground. And then I called my coworker who had who had na siya motor. Ako na, friend, aniha sa jud ko. And then he came, and then I was brought to the office, and then I didn't work for that day because it was so painful. And I was on painkillers, like really strong painkillers. So I thought it was just a sprain, right? I thought it was just a sprain. So I was at home for like 4 days, I believe, and then dito jud ako maantos ni adto kong hospital. I had it X-rayed, and then when I saw the X-ray before I even saw my orthopedic surgeon, I already saw the X-ray, and this was what I found, no? So ako ka, oh my god, there is something wrong. Okay, this is the anterior view. Kini siya. This is the anterior one. Anterior meaning facing the front, no? This would be the femur, and then this would be the tibia, and this one would be the fibula. Yan. So, pagkakita na ko, oh my God, look at this. Look at that. Oh no. I see it. And then, mas worse pa jud when I saw the lateral view. Kanisha, this one, this would be your femur, your tibia, this one, tibia, and then your fibula. Okay. When I saw this, look at that. It's a huge ass fracture. So I really fractured my bone. So what happened to me? So I talked to my orthopedic surgeon, and then he told me that you need surgery. So I went into surgery like a few days later, and then I came out from the surgery with rods. Okay, let's go here. So we're going to talk about bone fractures. Kinsay na nabalian nagbukog diri? Raise your hand. Raise your virtual hand. Wala. Wala pa yung nabalian? Good. Okay. So, kung wala pa mo nabalian ng bukog, congratulations to you. I do not recommend it. Okay. So, if dali lang mo dulaan, please don't look at the picture. Piyong lang mo gamay ha. Paminaw lang mo sa akong voice. Mag-ASMR sa ta. But if dili mo, dali lulaan, you can look at this picture. This is fascinating. Uh-uh. So, bone fractures are basically breaks in bones, no? And you have your closed and then your open fractures. When you say closed fracture, which is also called your simple fracture, it means nga na-break ang imong bone pero walay break sa skin. Meaning, wala na si-isian imong skin. And then you have your open or compound fractures. This is the kind of fracture wherein na-break jud imong skin, like naa jud ning gawas nga bone. This is basically this is very tragic. Sakit kaini siya. And this is commonly found in like vehicular accidents, like the worst vehicular accidents. And this is also like the worst, like the worst places that you can see this is during soccer matches, like soccer. Oh my god. And basketball. Oh my goodness. It's in my brain. It's in my brain. But yeah, there was like, oh my god, there was like this one soccer match that I watched na nakita jud na ko ang woo, nakita jud ako ang bone breaking the skin. It was horrifying. And can you just imagine, like, just playing soccer? Just playing soccer. You can break your bone. You can have like an open fracture. So bone fractures are treated by reduction and immobilization, which basically aligns your bones. Now in the operating room, we call that your ORIF or open reduction. We call that in internal fixation. Pwede sa siya or ref, no? Either of those. When you say or ref, same gap on open reduction but external fixation. So, what's the difference between the two? Ang or reef or the internal fixation, pareho atong akong gipakita kini siya because naara man sa sulod ang rods, no? Giana naman sa sulod. Ang external fixation is makita nimo na siya, makita ka na kanang bitaw mura sila kanang bionic man. Nas mura sila robot na asli mga kuan diri na sila metal ga help sa fixate sa bones, no. Kada sa kanang makita nimo na siya sa kanang grabe kaayo ka complete fracture like nabalik jud pag-ayo kada siya that really needs external fixation. But it depends on the fracture, ha? It depends. In my case, it's just internal fixation. And I left the operating room with two screws. Ma'am, um, dabi kong kuan ma'am, dabi ko na ay metal detector. Well, metal detectors use funny kay kuno I'm just asking ako ang nag-ask question, ako yung mag-answer. Metal detectors, they are ang mechanism na nila, they use magnetism to detain these metals. Fortunately, ang kining ato ang rods na ginagamit nato internally for the fixation of bones is they're made of titanium. Titanium is not magnetic. So it's no problem if you're gonna go on an airplane, you're gonna fly, you're going through like doorways with metal, they don't get detected at all. All right. So these are the common types of fractures. You have your comminuted, where br- bones are broken into many fragments. Ouch. Sakit kayo na. Sud kayo na siya i-fixate. Muna siya ang lisod kay fixate. It needs an internal and also an external fixator. It has both. Or naasad kay compression or and depression. Compression is when bone is crushed, and depression is broken bone portion is pressed inward. And then you have your impacted bone, which is where your broken bone ends are forced into each other, now push sila against one another, and your spiral fracture, ouch, sakit kini siya. So there's a ragged break, uh that occurs when excessive twisting forces are applied to the bone. And this is usually found in like little children. Kana bitong children of child abuse, kanang child abuse ilang parents. Kanang grabe kay mo twist ang parent sa arm sa bata sa iyang pag-twist kinabali. This is the sad reality. Noy kaayo. And then you have your green stick fracture where bone breaks slowly and much in a way green twig breaks. This is the kind of fracture that I had, green stick. And this is the most common as well. So, in the repair of bone fractures, of course, naa kay hematoma na ma-form. Hematoma, basically, these are blood-filled, how do I say it? Packets sa imong skin. And then the break is splinted by fibrocartilage to form a callus, and fibrocartilage callus is replaced by a bony callus, and the bony callus is remodeled to form a permanent patch. So, am I going to have those rods forever in my tibia? No, they will be removed. Actually, they ideally they have to be removed like 2 years after. So, dapat last year ko nag-remove sa akong rods. However, I didn't want to go to surgery during that time because of the COVID-19 pandemic. I don't wanna. Even my doctor told me don't do it now. So okay naman siya if it's okay naman siya if it's going to stay for a long time in your bone because your bone has already healed during that time. So nag-form na siya aning mga uh, uh, bony callus niya. So yeah, it needs to be removed because um I have to remove it because kini ba kong rods because of them being metal. Night times when they are uncomfortable, like when it's very cold, like kanang kusog kang aircon or even kanang cold places, um, the very cold places like katuni adto kog Baguio atong 2 years ago in 2019. My God, because it was very cold in the morning, kanang mga 4 a.m. Ang akong knee was like so stiff. It was so stiff. So yeah, mana siya. So I want them removed as soon as this pandemic is over. I don't know when it's gonna be over though. All right. So question: what mineral and what vitamin help in bone health? Kindly answer in the chat box. Kindly write your answers in the chat box. What mineral and vitamin help in bone health? Just one of both. So, usa ka mineral and usa ka vitamin. Okay, go ahead. Please answer. Katong kamulo ng laba, kamulo ng hugas, kamulo ng nga tulog. This is your time to shine. Sarot. Roldan says calcium. Okay, good. So, ang mineral kuno daw niya, ay, mineral. Ay, lagi. The mineral is, okay, calcium. Good, good. And then your vitamin would be your vitamin D. All right. That's correct. So, ganong, why do they go hand in hand? Because vitamin D actually enables your body to absorb the calcium. Without vitamin D, it will not, your body will not absorb the calcium. As simple as that. Ana. Another thing is, another important thing to remember is vitamin D does not work without sunlight, without UV rays. Kana siya. So without UV rays, dili sad mo activate ang imuhang vitamin D. So make sure that if you're taking like a multivitamin like Centrum, Inana Centrum or whatever multivitamin you have or vitamin D, just straight up vitamin D, make sure that you get sunlight exposure. Okay? Make sure that after you take it, you get sunlight, you go outside for a little bit, painit ka, ana, like 30 minutes or so, and then come back inside. Ana. So, just a helpful tip, ha? Manana siya. Vitamin D. It needs sunlight. All right. Thank you very much to those who answered this question. Okay, so this is the anatomy. I'll just show you the anatomy later, the gross anatomy later, ha? Ayan. Gusto ko katong kuan, katong human atlas nga art. And then you have your joints, no? And we will focus so much, we will place a lot of our focus in the synovial joints. Joints or articulations are functional junction between bones or the site where two bones meet, as I've said kaganina. They bind parts of the skeletal system, make possible bone growth, permit parts of the skeleton to change shape during childbirth, and enable the body to move in response to skeletal muscle contractions. Mom, have I read that correctly? It permits parts of the skeleton to change shape during childbirth? Yes. For the girls. Yes. It's horrifying. Very horrifying. Why? Because pag manganak ka, this part of your spine, kini siya nga part, it will physically change. It will physically like dislodge itself para ma-push niya imuhang baby. So, the amount of pain that the mother is experiencing is indescribable. Like, boys, you have to know this ha. Kanang kung makaburus mo in the future, walay problema ma'am kay bayat man ko ma'am. Bahala na. Okay. Kanang inaana mao nang kanang dili ka understand ang ilaha ang mga pregnant women sa ilang pain. It's because it basically bone trying to dislocate itself. Sakit kay na siya, no? So, inanak kakapoy mga anak, actually. So, this part, that part of your spine will try to dislocate itself para ma-push niya o ma-accommodate sa niya ang baby. Gusto pa mo mga anak? I'm just kidding. Okay, so yeah, you read that correctly. Yes, we do. The girls, the women, we are so talented that we can dislocate our own bones. Yeah. Okay. So you have these types of joints. You have your synarthrotic, amphiarthrotic, and diarthrotic joints. Ang synarthrotic, these are immovable joints, just like the joints that are found in your ribs. Kana sila. Your amphiarthrotic, which are slightly movable, just like your the way that your vertebrae move, no? Actually kuan na sila gaana na sila slide na sila against one another. And your diarthrotic, which are freely movable, just like your wrist, your elbow, your shoulders, that one. So these are your joints. Now, there are three main groups of joints. Now, you have your fibrous, cartilaginous, and your synovial joints. Your fibrous joints are named because fibrous tissue is the one holding them together. So, there is no joint cavity present at all. So, most fibrous joints are immovable and they lie between bones that closely contact one another. These are found primarily in your skull. Kana sila. Your skull is made up of different bones, right? So these bones are then fused together through a suture. You call that a suture. So there are three types of fibrous joints. You have your syndesmosis, which is where the distal end of the tibia and fibula mo na siya ilahang connection, no? And then your sutures, which are very much found in your skull. So this is only between your flat bones, and your gomphosis, which is found in the root of a tooth to the jawbone. Isod sa din kung imong teeth kay nagalihok, murag joint. Weird. All right. And then you have your cartilaginous joints, which are which is where hyaline cartilage or fibrocartilage connect the bones of these joints. Why did I pronounce it as bones? Sorry. There are two types, of course. We have your synchondrosis and your symphysis. Your synchondrosis, this is the articulation between the first rib and the manubrium. I'll show you a picture later. And your symphysis, just like your symphysis pubis in your pelvis, just like this one. Okay. So, mani siya ang kaning symphysis. This one right here. This one. This is your ilium, no? Ilium. Your left and right ilium are then connected through this joint. But this joint is immovable. Okay? Di na siya move. Imagine na kung ay mong hip kay move. Weird kayo. And then your synchondrosis, which is found as a connection between your manubrium and then your rib. Kanisha. So that is your cartilaginous joint. And then let's go to the synovial joints, which are your diarthrotic joints. No, they can move any way you want. Ayan. So these are the five distinguishing features of your synovial joints. You have your articular cartilage, which is present at the ends of the opposing bones. This is the one that I talked about earlier. Na dili pwede mag-grind ang bone to another bone. Kay sakit kay na siya, no? So there is a cushion. There is support there. And that is your articular cartilage. And then you have your joint cavity, or your synovial joint cavity, which is like a hollowness, no, found there. And this space contains your fluid, and that fluid is your synovial fluid. And then you have your articular capsule, or also known as your joint capsule. This encloses the joint cavity. And then your synovial fluid, just like what I said ganina, is present and occupies the space within the joint and the capsule. So this acts as the cushion, no? This is the one that is helping the joints not to grind against one another. And you have your reinforcing ligaments. Your synovial joints are reinforced and strengthened by a number of band-like ligaments. Ayan, connecting bone to bone. And then you have your bursae and your tendon sheaths. Um, your bursae are flattened fibrous sacs lined with synovial membrane, sorry, and containing a thin film of synovial fluid. So, where is your bursae? Just like this one, no, sa imohang femur tibia connection. So, naakay part diri that is filled with your synovial fluid, and that is your bursae. Bursae is a plural, bursa is the singular form. And then you have your tendon sheath, which is essentially an elongated bursa that wraps completely around a tendon subjected to friction. Ayan, which are found in your fingers. Actually, dakan man siya, but commonly found in your fingers. Kaya siya. Wala may muscles good diri. There are no muscles here. The muscles that control your fingers are right here. No, so kana siya, the connection to that, your muscles and your ano, your what you call it, your bones here. These are your tendon sheaths. So let's go to the six types of synovial joints. Let's start with sorry. Let's start with your ball and socket. So this is the most kanang distinguishable. One is siyang pinaka obvious, no? The ball and the socket joint consists of a bone with a globular or slightly egg-shaped head that articulates with a cup-shaped cavity of another. This is found in your legs. You know, your ilium and your femur nga connection. That one right here. And also this one, kining shoulder. This is a ball and socket joint. So these joints allow a wider range of motion that does any than does any other kind. They permit movements in all planes as well as rotation movement around the central axis. So manang maka-rotate ni siya, makasaka, makanaog, maka-side to side. Daghan kaayo siya range of motion. So that is your ball and socket joint. Next would be your condyloid joint. This type of joint permits a variety of movements in different planes, like your rotational movement, but your rotational movement is not allowed. So this is found in your wrist. Huh? Yan. Ayan. Diba? Igo na ni mo siya side to side, ana. This is not the rotational movement that I'm talking about. Lahi na siya. Because this one, although it looks like it's not rotation that's being done by this joint at all. So that is your condyloid joint. Your gliding joints, nag-glide lang sila one another, against one another, mag-slide lang sila against one another. These joints are found in your Igunin mo ana-ana, 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 mga ankle. So, not a lot of range of motion happening there. Your hinge joint. Hinge. Imagine ang imuhang door. Di siya, di ba? Ana-ana naman ni siya. Tuya naman na siya. So, that's your hinge joint. That is found in your elbow. Na siya. Ana-ana siya. Flexion, extension. Flexion, extension. Maura na ang mahitabo sa imuhang elbow. So such a joint resembles the hinge of a door in that it permits movement in one plane only, just like your elbow. Flexion, extension. Maura. Pivot joint. In a pivot joint, the cylindrical surface on one bone rotates with a ring formed on bone and fibrous tissue of a ligament. So, naan lang siya, rotation around a central axis, just like this one. Just like what you're doing with your neck. Na ako'y stiff neck sa left, so muna dili kin ako siya ma-rotate tarong. So, muna na siya. Oh, in one plane and also na kay x-axis and y-axis. Na, mura na imong mabuhat. That is also being found in this joint right here with your radius and your elbow joint. Kana siya. Pronation and supination. So that is your pivot joint. Then you have your saddle joint. A saddle joint forms between bones whose articulating surfaces have both concave and convex regions. This physical relationship permits a variety of movements, mainly in two planes, found in your thumb. Tanawa imong thumb. Na. Look at your thumb. Your thumb can go through a lot of planes. No? Of course, siya ka for double jointed people, pwede na lang ma-bend backwards ng bunga-bunga, but for us, normal people lang, dili. So that's your saddle joint. All right. Now, I think this is my last question. What part of the human body can you find the smallest joints? In what part of the human body can you find the smallest joints? Kindly answer in the chat box if you have an answer. Anybody? In what part of the human body can you find the smallest joints? Between the bones and the middle ear. What? Bonggang bonggang Google. Okay, yes, that's correct. No, so you can find the smallest joints because your middle ear is also the site of the smallest bones. It just makes sense na ang smallest joint sa nimo kaya ma-find sa nimo sa imong ear. Okay? Is that an ear? I don't know. All right. Thank you very much. Marami siyang elf nga ear, oy. Basta. Thank you very much to those who answered. All right, so that actually concludes our lecture series. Let's go to the gross anatomy sa imuhang ko ano sa imong skeletal system. Now sa nato ang reproductive system. The we did not cover whose gross anatomy we did not cover last week. I'm so sorry about that. Okay, let's go to. Okay, let's go. Okay. Let's start with the male. Ayan. Let's start with the male. For the male, or very obvious, no? Let's remove the muscle parts. Ayan. You have your scrotum, the ductus fascia. That's basically the covering of it. The covering. Okay. You have your. I'm gonna remove this. Ayan. Then you have your testicles. Yeah. Why is there a fascia? I want to remove it. Wait a minute. Ah, because I chose the internal genitalia dito. Okay, okay. Dahil lang ta. Yeah. Hala. So, pag zoom in, ayaw niya. Wait, wait, wait. I'll find the... Ayan, ayan. So, of course, this is your scrotum, your glans penis, of course, and this is your corpus cavernosum. And then this is your box fascia. This is your pair of testicles, your gonads. Fascia, dito yung kuan. Gusto ko walay fascia. Gusto ko internal. Then this is your bladder, of course. Sorry, bladder, prostate, which can be accessed through your anus. Then this would be your seminal vesicle. Dili ni sila moagi no, mong semen. And then pak, madto din siya paingon sa imong gonads to get the actually ang what do you call this ang sperm, it will pass through that and then it will get semen, so that the semen is the vehicle no mo din na mogawas din siya dinhi sa imuhang penis, glans penis. Ay, abi na ko unsa to. Let's do another view. The testicles. How nice. Yan, yan, yan. So these are your testes, or aka your gonads. This is your ano, epididymis. Your epididymis is also the site of your sperm production. Then moagi din na as I've said kanina sa vas deferens. The vas deferens is the one that is being cut during vasectomy. It depends on the kind of kanang surgery that you're gonna get, because na ibang doctors nasayangan sila, so yung sa ato nila ni itay no, pwede sa na nila butangan nila og kanang surgical thread, then ila na siyang itay hangtod nga ma-close niya ang vas deferens. But that is not an assurance, of course, because sometimes na may mga faulty wiring, faulty nga pagtay, so ma-antay na siya and then maka-impregnate siya og women. So if you want like the legit vasectomy, men would have these two, the two vas deferens cut, ma-sever ang iyahang ties. Then, dili na din madala ang sperm paingon sa imuhang prostatic capsule or your prostate, which is the site of your semen, no? Seminal vesicle. Ayan. So, dara din na siya. Okay, what about for the ladies? Let's go to the ladies. Let's change gender. Let's go to female. Ayan. The females. Ayan. For the females, you would have your labia minora. Asa day ang labia majora, ma'am? The labia majora will be, ato i-adi ha. This will be the labia majora. Now, if you remove that, the skin part, this will be the labia minora. And then you have two holes. Dili pre sa lalaki nga, usa lang kabuok. Sa babae, duha kabuok, no? We have your vagina and your urethra or your urethral orifice. This one right here will be your clitoris. And then this will be your vagina. Vagina. Let's go to an internal view of that. Internal. Ayan. Di makita. Di makita ang cervix. Wait, let's go here. Dali na lang. So of course your vagina will go into your ovary. Oh, ovary. uterus right here. So ang uterus sa babae is actually behind the bladder, no? Behind the bladder, our urinary bladder. That is why if ma-pregnant gali ang babae, let's remove the bone. If ma-pregnant ang babae, mudako man ni siya pag ayo, di ba? Kay naaman diri ang baby sa uterus. If ma-pregnant ang babae, mabangga pirmi ang imuhang bladder. That is why ang imong pregnant women, they pee a lot. They pee. Kasi sa pangihi. Maunang kay nagamay naman ang space sa imong bladder. So that is why they pee a lot. And then this will be your uterus, as I've said here, and then naading kay ovaries right here. This will be your fallopian tube, kanisha, and this will be your ovaries. Left and right. And di na to mag-discuss ureters. Okay, so that is your female reproductive organs. Let's go to the skeleton. This will be your actual skeleton, skull, vertebrae, your vertebrae, and your rib cage. And then these will be your appendicular skeleton, your limbs, your arms, and your legs. Let's go to the skull. As I've said kaganina, your skull is made up of many flat bones, no? As I've said kaganina, they are connected through sutures, kinisa na joints right here. So you have your frontal lobe, your parietal lobe, left and right. You have your temporal lobe right here. And then you have your posterior lobe, sorry, your occipital lobe right at the back. And then you would have these kini siya butangan ninyo for the girls kana butangan na ninyo og highlighter. Chuk, 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 chuk. Ana, that is your zygomatic bone. And then you have your maxilla right here and your mandible. The jaw. The one that you open and close. That's the jaw right there. And then you have this weird bone that's floating right there. You can actually feel that right here. That's your hyoid bone. So that's your skull. Hello, skull. How are you? Hello. I'm kidding. I'm just kidding. Okay. Um, let's go to the rib cage. Mani siya ang joints na kung pasabot kanina, no? You have the joints that would this the immovable joint between the first ano. This is an immovable joint between your um what do you call this? Your manubrium, sorry, your manubrium and your clavicle. Right here. This one's right here. Nanaslay joints tanha no sa imong ribs. And then your ribs, na ay duha ka buka pair sa imong ribs nga ga-float, no? Kini sila. Floating ribs or false ribs, we call that. Because they're not connected to the manubrium at all. Nala sa din ha. Nakulangan lang sila og evolution. Okay. That is your thoracic cage. And now let's go to your pelvic girdle. Ilium. Left and right ilium. Oh my god, I spelled ilium incorrectly ganina. I'm sorry. It's ilium. Sorry. You have your ilium and then there's a joint na involved ani nila, no? And that is your pubic symphysis. And then you have your bursa. Basically sacs of synovial fluid right there. Let's go to the irregularity of your vertebrae. So as you can see, your vertebrae has different shapes. That's why they're called irregular. Oh my god, di na ko makita ang cervical part. So in the thoracic part, kini siya na mga part, kining T3, ana, T9, T10, ana, until T12 madali ni. Oh, T12 siya taman. Kana mga thoracic nga vertebrae, they are sort of like in the same shape. Then starting din diri sa lumbar, lahi na din na siya nga shape, no? And then if makaingon ka nga hait, ma'am ning sabak ang akong boyfriend, ang babe sa ako, ma'am niya hait kay iyang sampot, ma'am. Okay. Kanang hait o sampot mao ni siya, no? That is the culprit. That's your sacrum. Mao ni siya ang culprit sa kahait sa imuhang samput right here. Your sacrum. Let's look at some media. The your synovial joints are able to move like this. But your shoulder joint is a ball and socket joint, right? So grabe kay siya o kanang range of motion. Daghan kay siya kuan, pwede siya mag rotation, oh sorry, lateral rotation, pwede siya mag medial rotation, pwede siya mag flexion extension, adduction. Adduction is going towards the middle. Abduction is going outwards, far from the middle. And then daghan siya ko ano. Or ini siya your what kind of joint is that? Sa imong thumb? The saddle joint? Mm. Mo ni yung mga skills. That's extension and then wala na ilain na media. But it does a lot of things, no? Naa siya extended range of motion. This one. That we're able to do this, connect our fingers, finger to finger, or thumb to fingers. All right. So those are some examples. Okay. So that is it for our gross anatomy. I'm gonna stop presenting now. Kay murag ang fan sa ako ang laptop is like gaana na siya, no? All right. So that is it for our lecture series. And that concludes our lecture series. So last atong skeletal system nato. So, are there any questions? Please do ask if na ay questions. If wala, okay ra sad sa ako ah. But it would be better if you have questions. Do you have questions? STEM 4? Are you still there? Raise your hand if you're still there, if you're still listening. Bahalag, ASMR ako ninyo. Okay. All right. Ayaw sa ninyo i-put down inyong hands, ha? Halak ka ang uban. Where are the others? Tulog na. Okay. Wala na. Tulog ng everyone. Ay, tulog ng uban. Okay. So, maybe they're busy. I don't know what they're doing. Anyway, so, I'll be posting your last short quiz right after this. And also, you can unraise your hands. Thank you very much. You can put them down. And then I'm going to also post the link to the recording of this later said once Google is done rendering the video. Now, reminders lang, next tomorrow will be your major session. So same groups as before. So I expect no kabalo naman mo what's gonna come out. So I expect that you are ready tomorrow. Ready and ready to face the day and also to face the challenges and also answer the questions of not only your classmates but also me. So make sure that you're ready, that you have properly researched, and that you are ready to answer the questions. remember, you are only allotted 15 to 20 minutes to present your disease. Do not forget the minor pathophysiology. Like, gamay lang nga pathophysiology ano, of your disease. And then, uh, pwede ta mo exceed gamay sa 20 minutes, but make sure nga importante kay ang details, okay? So do not talk about like do not talk very extensively about it. Dili kayo, you don't need to like taas-taason pag-ayo. Just talk about like the essential things, like things that you find very essential pertaining to the disease. And then, yeah, that would be it. So tomorrow we'll be hearing from groups 1 to 3, and then on Wednesday, we'll be hearing from groups 4 to 6. All right. So that will be all for this morning if there are no more questions. So I'll bid you a goodbye and good morning. And if you do have questions, please do not be afraid to PM me for your questions. Okay, so that will be all. Thank you very much. And please don't forget to answer your short quiz. I'll see you again tomorrow. Goodbye, STEM 4.
Bye, ma'am.
Bye,
Thank you.
ma'am. Thank
Bye, ma'am.
you.
Thank you.